So that should be it for the follow-up. Okay, next we have, thank you so much, we have Dr. Bill is on next. So there you go, Dr. Bill.
Very good, thank you. First, I want to say to Dr. Resnick, that was really a wonderful overview of assessment, its function, and how it can be done these days. It's interesting because I've talked with Candace, and one of the things that I've been working on in terms of research and development is a way to use video images of facial expressions to do assessment. That's right around the corner. So what I'd like to do is to use technology and do a screen share to sort of guide me through, because what I've been doing a lot of is working with trauma and post-traumatic stress disorder. And that doesn't sound necessarily like, yeah, it would fit into the topic of this evening, which is attention deficit hyperactivity disorder. But as Dr. Resnick pointed out, there's a huge comorbidity in the population of people with ADHD, and ADD and attentive type. Both children and adults. It isn't an ADD-friendly society that we live in. And so there is an awful lot of overlap, and the definition I have in my own mind, and that is sort of the working definition in the NIH domains of function group, which is looking at how to replace the DSM and ICD-9 diagnoses by looking at function. Rather than saying this person has these symptoms, it's like, what's going on with that? How are they managing their life? Post-traumatic stress or trauma consists of something that goes on in your world that overwhelms your coping abilities and impairs your function. Well, I don't know about the rest of you, but for me, COVID-19 certainly fits that criteria. And when I take a look at what's going on with the findings, the research about how people are faring, and in particular, those of us who have attention deficit disorder, it's clear that there is a great deal of challenge and trauma going on. So let me share my screen, and hopefully this should be showing up now. I don't think I can do a full-on PowerPoint without losing Zoom, but the first slide here is ADHD in the time of COVID-19, reactions to a 21st century chronic psychological trauma. I think we're all facing, chronicity of the trauma. When we take a look at, wait a second, do this. When we take a look at what's going on in terms of mental health concerns, the blue columns here in this histogram are in 2019. And in 2019, approximately 18% of adults recognized that they had some kind of anxiety or depression issue. Currently, it's 40%. You take a look at men versus women. Women in 2019, it was 23%. Now it's 47. And among men, it was 14%, and now it's 36. So people are really suffering from the ongoing strain. When you take a look at men versus women, in families where there is a child under 18 years of age, and this is where a lot of the work that we do comes in. In this group, we're working with families. Okay. 57% of the women are saying that there is some kind of emotional impact that they're having to deal with right now, and 32% of the men. So if you have a school-age child, the emotional impact of this pandemic is especially high. Then if we take a look at age groups, and this is particularly distressing to me, and it lands right in the population that we work with the most. 50% of 18 to 29-year-olds are expressing some concern about their emotional well-being, anxiety and depression. Okay, 39% between ages 30 and 50, 31% 50 and 70, and over 70, 25%. So our youth, and this particular study, this is Center for Disease Control. I didn't find the data for under 18, but there's a definite trend here that suggests the numbers would be even higher. There's also other research I'll talk about later. Now we take this and combine it with the comorbidity that Dr. Resnick was talking about. Okay, if you have attention deficit hyperactivity disorder and generalized anxiety disorder, there's a 40% overlap. This is prior to the pandemic. So if you have ADD, you're very likely to have free-floating anxiety. The overlap with depression, situational depression, and dysthymia is close to 60%. So there's a lot, this is again prior to what we're coping with now. So our clients have needed in therapy, and the families that are supporting them have needed a great deal of assistance with the emotional strains that are there. Now, when we take a look at how the pandemic is affecting kids who are ADHD, this is from a study that was done with close to 300 families in China after the pandemic had hit. 300 families in China with children who were diagnosed with attention deficit hyperactivity disorder. They assessed them and asked for input about what had happened with their behavior. There was 66% increase in angry outbursts, a 56% increase in inability to follow routines, and 50% increase in the symptom of difficulty with concentration. This speaks really, very, very clearly to the needs that are there and the kids that we've been working with. When we take a look at COVID as a trauma, and bear this in mind, against the backdrop of the information I was just sharing about, ADD and, the baselines of emotional vulnerability. The traumas that come with dealing with this pandemic are feelings of isolation, vulnerability, and uncertainty, derailed routines, illness and loss of relatives and friends, and the experience of other people is dangerous. Before we got started in the panel, a few of us were talking. I was mentioning I was out in West Virginia. I heard, oh, we've been out there and I didn't see anybody with masks. That's right. I mean, the politicization of all of the needs for medical care is super intense and is another stress that is hitting the most vulnerable.
Yep.
So what this plugs into is there's great difficulty for those of us with ADD to have heightened demands on our executive function, planning, prioritizing, organizing, coping with isolation. This is not easy for us to begin with, okay? Those are the things that are feeding into the numbers I was just talking about in terms of the increased demands on mental health services, on practitioners. Dr. Resnick was talking about assessment by telehealth. I've been doing all of my therapy sessions by telehealth. And one of the things that's really hard is I've seen in that 18 to 29-year-old group, I've seen clients who were doing quite well really regress to the point where they're overwhelmed, and a couple of situations where they required short-term hospitalization. So it's really good that we're talking tonight about how we can assess and find out what's going on, and also what we can do when we have clients who are facing these kinds of demands and these kinds of challenges to their functioning. Okay, for the adults, let's look at it in terms of, you're a parent, with an ADD child. Well, there's a pretty good chance that you may have, at least one of the two parents may have ADD themselves. But even if you don't, here are the things that are almost universally recommended. Create a schedule for yourself and stick to it. Get the right amount of sleep. Get up at a consistent time. But you need to be flexible, particularly if you have an ADD child. You need to individualize to their needs and be able to provide the routine so they know what's coming today, but if you need to, throw that out the window so you can join them where they are. Establish healthy sleep, diet, and exercise routines. That goes under the schedule and routines. Create a calming environment. Now, this is for yourself, also for your kids, but if you're going to look at how do you do this for yourself, you need to have some time out. You need to be able to get, spell one another. If you're parents, or if you have grandparents, you can press into service to help out. Listen to some calming music. Take some time to go out and do, they're calling forest bathing. Go out and enjoy nature. It's really critical that you do this because we're being, aggravated all the time by these stresses. Keep a journal and write down your thoughts and feelings. It's very easy to get swept up in the moment these days, especially when we compound the pandemic with what's going on in the streets of our country and Portland and other places. Practice mindfulness to help keep things in perspective. I could go on a great deal on this, but this is a really critical piece. Mindfulness is giving your full attention to the present, whether it's tuning into your sense of sight or your sense of hearing and listening for what's the farthest thing away from you that you can hear. What's the closest thing? What does it sound like where there's no sound? What does it sound like under the bed or under the steps? If you do this even 5 or 10 minutes a day, it will begin to help you disconnect from the ongoing frenzy. And it's really important to socialize, and we're doing some of that now in terms of being professionally networked and connecting with the people who we're providing services to. But it's important to connect with the people that know you, so that you don't lose track of who you are in the midst of the isolation. Okay. For ADD children, here's an interesting thing. It comes from Attitude magazine. This is where I got the data. How are people helping, regulate what's going on, or help their kids regulate what's going on with them? The most frequent method that people are using is ADHD medication. Okay. There are a number of parents, a significant subset of parents, who are finding that they don't seem to need to have their kids medicated as much since they're not in a school setting. Okay, that's I have under the things that you can do. Consult with your child's doctor about any changes you're thinking about making their medication. Don't do it solo. But if one of the things that people are finding is, okay, get out and exercise. Take the kids out for bike rides, take them out for a hike. I live on a river in West Virginia. It's really wonderful. I see families doing floats down the river in one-person kayaks. It's highlighting what Dr. Resnick was saying about the being a bad fit with seat work. I mean, the kids don't have the bandwidth to sit there, in a classroom. Well, guess what? Maybe Sam will have, some really wonderful insights into what the schools can do about this. But I've had kids that have been lost to learning because, the telehealth or the virtual classes just don't hook them enough. They need to have the feeling that they're connected to a teacher they have a relationship with. Okay. Use behavioral strategies with your kids. we know to simplify and repeat instructions, break complicated tasks into small pieces, use rewards. Screen time. This has been, a battle for practically every ADD parent or parent with ADD kids that I know. They're totally invested in the constantly changing stimulation of screens. Okay. Well, these days it makes sense to have more screen time than would be usually the case. But you need to have some structure around that, and you should really try to keep as much of it social as you can. And then one of the things, and I don't know that I got this this piece in here, but it's where I will wrap up. One of the studies I thought was really interesting was a study that was done in collaboration between Sheffield, England, and a city in China. And they were looking at the relationship between ADHD children's dysregulation, parental mood, and the interactions between them. And not too surprisingly, it was sort of like a Mobius strip feedback loop. As the kids became more dysregulated, the parents became more irritated, the parents became more irritated, the kids became more dysregulated, right? So it's really important that as a parent dealing with the stresses of ADD, homeschooling and, trying to take care of your kids 24/7, focus on what you like about your child and remind yourself that one day this social isolation and quarantine is going to be over and your kids are going to be gone again. They're going to be back in school. They're going to be, back to the routines, and you're going to be back at the office. There is in fact a gift to be had in this time if you can stay grounded and if you can find a way to soothe yourself and soothe your kids. It's a really beautiful opportunity. So that's one of the things that I'm trying to help my clients with, is to remember that, and that I've been reminding myself, in my interactions with my spouse. Of course, there's no issue that she would have with me. We really need to be humane about our interactions with one another. So that's where I will leave off. Again, as Dr. Resnick said, I really, really appreciate this opportunity, Candace. It's really important that we can support one another and connect in ways where we're thinking clearly about what we're dealing with at this time. Thank you.